One of the most prevalent fallacies in COVID misinformation is the false choice. This fallacy is known by various names: false dilemma, either or fallacy, and false dichotomy. A false choice forces you to choose between two options when other options might be available, or both options might be true.
Do or do not. There is no try.
The false choice fallacy is like arguing that either eggs come out of chickens or chickens come out of eggs. In reality, both are true. Having to choose one or the other is a false choice. Sometimes false choices involve focusing on two extreme positions while ignoring any middle ground between the two.
If you're not with me, then you're my enemy.
Only a Sith deals in absolutes.
We see this absolute version of the false choice fallacy in some of the discussion around COVID-19 when we're presented with a choice between two extremes: total shutdown until a vaccine is developed versus going back to normal now.
We're not going to let the cure be worse than the problem.
We cannot put paralyzing panic and over-practical precautions above Americans working.
There won't be a recovery unless we reopen schools now.
We're being asked to choose between public health and the economy, but the two are inextricably linked. You can't have a healthy economy if millions are sick or dying. When people are afraid, they're less likely to go out and spend money at the risk of getting sick. There's no reopening the economy without controlling the health crisis. We saw this dynamic in 1918 during the Spanish flu pandemic. An MIT study published this year found that the cities that shut down earlier and for longer suffered less deaths than the cities that opened up earlier. This is what you'd expect, but here's the interesting part of the study. The cities that stayed locked down longer also made a faster economic recovery than the cities that opened earlier. A University of Chicago study, also published this year, found that social distancing has downstream economic benefits. Even moderate social distancing would save 1.7 million lives from COVID-19, which translates to a benefit of $8 trillion to the economy. Having to choose between public health and the economy is a false choice. Simply opening the whole country while a pandemic is raging won't result in a healthy economy. People won't feel safe enough to return to normal. The suffering economy is largely due to the pandemic, not the measures to slow the spread. If we want a healthy economy, we also need healthy citizens. Ironically, the people calling to reopen the economy are deploying a range of fallacies to argue against the very things we need to reopen the economy safely: widespread testing and contact tracing to contain outbreaks, wearing masks to reduce the spread of the virus, and continued social distancing. So when you're presented an either-or choice, ask yourself, are they the only two options? Is there a third option? Or is the answer somewhere between two extremes? False choices can lead to wrong conclusions, like thinking chickens only come from eggs and not eggs from chickens.